Okay, good evening, everybody. It is Fertility Talk Live, Wednesday evening. It's September and it's still the month of PCOS and PCOS awareness. We're just going to give everyone a couple of minutes to get the notification that we've gone live. So I've gone live just a minute or two before the time. So I see Dr Skye de Jongh is around, and I'm just going to accept her. But we currently going to be having load shedding at 8 o'clock. So that's I started just a few minutes before the time. And she is a fertility specialist at Vitalab or Vitalab in KZN. So thank you. Hi, good evening, Dr. de Jongh. How are you?
Hi, I'm very well, thanks. How are you?
Good, thank you. Thank you for joining us this evening on Fertility Talk. I was just telling everyone we've got load shedding at 8, so I just went live about 2 minutes before 8. I've got everything plugged into a UPS, so I'm sorted, not to worry.
Good.
Yeah,
Yeah, we
so
also
thank you.
had load shedding
So,
until 8, so I'm actually at a friend's house.
oh,
So I didn't
shame,
get interrupted.
Shaman. Okay, so thank you for doing this for us. So tonight's topic is PCOS and weight gain, which is quite a big thing. And the craziest thing today is that, so everyone knows that I also suffer from PCOS. It's a big thing for me. And today I had all these blood tests done with one of the insurance companies to do some policy, and they came back and they actually doubled my premium because of my weight, and because of the PCOS. And I had to eventually say to them, forget it. So I'm going to go back on my journey. As from Monday, I was like, look, okay, I need to get back on this. But I mean, that's how serious this problem is with the weight gain, the PCOS, and that type of thing. And there's so many women that's dealing with it. And yeah, so I'm very, very interested to hear and hear what you've got to tell us with regards to PCOS and weight gain. So thank you for joining us, Dr. de Jongh.
My pleasure. Yeah, you're absolutely right. This is such a huge problem, and PCOS and weight gain go hand in hand. The reason for that is that polycystic ovaries, it causes your body to become immune or resistant to insulin. So insulin is a hormone that is secreted by your pancreas, and that insulin will speak to your cells and it grabs the glucose that you eat and it knocks on the door to your cell and says, hey, can you let us in? And then that glucose goes into the cell and is used to make energy.
Yeah.
But when you have insulin resistance, then that insulin knocks on the door of the cell and the cell just ignores it. And so what happens is the sugar in your blood just goes up and up and up. And that predisposes you to weight gain because now that sugar can't be used for energy. So what does your body do? It stores it.
Yeah.
So you end up with weight gain, and then eventually you can end up with type 2 diabetes. So these are both very serious things. So what we need to do is to combat weight gain, just not just for pregnancy's sake, but for your health. Like you say, your insurance doesn't want to deal with it because weight gain and a BMI over the age of 30 can be associated with diabetes, hypertension, increased risk of
Yeah.
cardiac disease, increased risk of strokes. So it really is a serious issue. Not to mention the effects in pregnancy. So having
Yeah.
a BMI of more than 30 decreases your chance of conception. It increases your time to pregnancy. It increases your miscarriage rate. It will increase your preterm delivery rate. It increases your Caesar rate, increases the chance of bleeding at Caesar. It increases the chance of the mom getting preeclampsia in pregnancy, as well as gestational diabetes, which can both have huge impact on the development and growth of your baby and their ultimate survival. So it's not just about, being a little bit overweight, it's actually a huge issue. So it's weight gain and PCOS go so hand in hand that actually the primary treatment of polycystic ovarian syndrome to fall pregnant is weight loss. And I know it's when I tell people that patients who suffer from polycystic ovaries, it's the last thing they want to hear, because they know they've been struggling with this weight for years, many of their lives, many of them for their whole lives. So it's not what you want to hear. But thankfully, there are a couple of things that can help you to lose weight so that you can get to your goals. So most of the literature talks about at least a 5%, but optimally 10% weight loss in order to conceive.
Yeah.
So they say that 50% of people will start to ovulate on their own if you lose 5 to 10% of your weight. Okay, so if you're weighing 120, then that's looking like 6 to 12 kgs. Okay, so it's not a huge amount when you look at trying to get down to a BMI of 30. Most people are around 1.6, 1.7. So your BMI of 30 would be probably less than 90 kgs. And so we're not talking about that whole sort of 30 kgs that you need to lose. We're talking about 6 to 12, which is actually quite attainable if you've got help. Yeah. So the first thing, and the thing that has been studied the most, is diet. So the diet that is most researched and efficacious in the polycystic ovarian syndrome is the Mediterranean diet. So what does that mean? It means that you want to be eating only lean meats, okay, mainly fish. So the dietitians will talk about eating fish probably about 3 times a week, chicken twice a week, and then red meat only once a week, and then having maybe a 1 meat-free day. And when they talk about protein, they say that portion size should be about the size of your palm, excluding your fingers, just your palm. Then in terms of fats, they want you to only have the good fats, which are generally vegetable fats as opposed to animal fats. So you want to avoid things like chicken skin, butter, and rather go for options like olive oil or avocado oil, and eat your omega-3 rich foods. That'll be your avo and your salmon, or fatty fish. Then in terms of carbs, they say that the healthiest carbs are the ones that come out of the ground. So if it hasn't been doctored at all, then it should be good for you in moderation. So potatoes, sweet potatoes, butternut, beetroot, those kind of things, all really good for you. But the maximum that you should be having on your plate is about the size of your closed fist. That's the size of your carb. So on your plate currently, you've got a fistful of carb that came from the ground, that wasn't made from white flour. So we're not talking about pap, we're not talking about roti, we're not talking about bread. We're talking about whole foods. So you've got your carbs on the plate, then you've got your palm full of protein that's lean, and then you've got the rest of your plate is fruit and veg. So you're looking at salad or roasted veggies or whatever. There's so many different types, and they try to encourage you to eat the rainbow of colors on your plate. There is some evidence for intermittent fasting in polycystic ovaries. So they talk about not huge intervals, so a 14-hour interval. So if you say eat supper at 7, then your breakfast will be at 9. So that's quite, it's easy to attain. And the benefit they found is that if you eat at 7 and then brush your teeth, then that avoids snacking at night. So you tend to not say, oh, it's healthy, I'll just have 3 nectarines after dinner, or that's 1 piece of chocolate that turns into the slab. So that's a nice trick to try to minimize your caloric intake after your supper. And And then there is some evidence also for anti-inflammatory foods. So things that have high antioxidants in them. So we know that blueberries have really high antioxidants, some chilies. We know that, yeah, so most of your fruits and veggies are really good. But and also the spices, sorry, turmeric apparently is fantastic for you in terms of anti-inflammatory markers. And there's some evidence that eating gluten-free is also anti-inflammatory, but I'm not 100% sure whether, how applicable that is to the polycystic diet in particular. So diet really does have a big role to play. In terms of evidence for exercise, no one's expecting you to suddenly start running marathons, but some exercise, some mobility is good. So if you can try to do something every day, whether that's getting one of those watches and trying to get your 10,000 steps per day, or if it's going to the gym for 15 minutes, if you're just doing something every day, then that's what counts. Keeping active, and you want to be looking at doing cardio, because cardio is what uses calories. So in the end, if you're trying to lose weight, you need to be putting in less calories than you're using. Or using more than you're putting in, rather.
I had a talk the other day with sorry, our lights just went off. I had a talk with one of the professors as well from another clinic, and he was saying by just losing about 5 to 10%, you could increase your fertility rate by almost 80%. I stand corrected. I don't know if that's correct, but I was just like, that's amazing.
It is. So yeah, the stat that I know is that 50% will start to ovulate on their own. So if you're not ovulating, then your chance of conception every month is less than 5%. Whereas if you are ovulating, your chance is about 20% every month. So, it's a significant increase. So definitely weight loss has a huge role to play. And if you have been on a diet and you have been exercising and it's still not working, then there are other options. So we do have a couple of pharmacological things that can help in the forms of, so you may have heard of metformin or glucophage. That is a drug that sensitizes your cells to insulin. So it helps with the uptake of glucose into your cells. And the way that it does that is as a byproduct, it also decreases your appetite. So it is associated with a bit of weight loss, but not a significant amount of weight loss. It brings down your insulin, which can help with your ovulation, and it can improve IVF outcomes and decrease your miscarriage rate, which is quite nice. But as a weight loss measure on its own, it's not first choice. Then there are other pharmacological aids to decrease your appetite and to decrease your fat absorption, as well as an injectable that can also do that. And we've been seeing really good results with some of these pharmacological agents. And then, of course, the more sort of invasive approach is if you are very overweight and you've tried everything and you have something like 50 kgs to lose, then you can start going to consider things like bariatric surgery. And there's quite a lot of evidence that your fertility rate will increase following bariatric surgery, but you can't get pregnant within 2 years of having surgery, because then your absorption and your nutrition is not optimal at that point. So you need to rather wait, get your body used to it, and then thereafter try to conceive. And they found that your diabetes rate, your preeclampsia rate, your neonatal complication rate, all is much, much lower after bariatric surgery compared to before.
Okay, we've just had a question. What is the name to reduce insulin resistance? I think she's talking about the metformin.
Yes, yeah. So metformin, you'd need to get prescribed by a doctor. It is also used to treat type 2 diabetes, but it is safe to take even if you don't have it, if you just have high insulin. The other thing that's
Yeah,
very helpful is a vitamin called, there's many of them on the market that contain inositol.
yeah,
There's one called PCOS, there's Insumax, there are all sorts. And so taking a vitamin that's got inositol in it will decrease your insulin resistance. And then ideally, if you can have something that also contains coenzyme Q10. I
yeah.
know Insumax also has both of those. So if you can do that, then that'll help with your egg quality on top of decreasing your insulin. It also has
Yeah.
folate in it if you're trying to conceive. So these are just nice things to sort of sensitize your body, try and help with spontaneous ovulation, and try to improve your chances of conception.
Yeah, there's actually a new shake. I don't know. I've promoted it as well. The advanced fertility shake, and also has all those what you've mentioned, the folate, inositol, all those things in it as well, which is really quite nice, and it tastes good as well. Um,
Okay.
but yeah, so that's quite great. I was going to ask you another question. There's a question that a lot of women ask when it comes to if you're not looking at actually once you pass the stage of trying to conceive, is I think women have asked this, like, if what is it that you can do? Like, can you get rid of PCOS? Obviously, it's not something that can be cured,
Yeah.
but like some
You
women say,
can.
look, if you can have a hysterectomy, there's something. I don't like to talk about those type of things because
No.
we're dealing with infertility, but you
Yeah.
know,
So it's a really good question. So PCOS is a generally an inherited problem. So you'll find that your mom or your granny or your auntie also had it, and we don't know exactly what gene influences it, but we know that there is an inherited component. And basically, you're predisposed to that your whole life. We will see ladies at today. I scanned a lady who was 49 and she has the ovaries of a 30-year-old because she's got so many follicles left because she's got polycystic ovaries. So it's going to be with you for life. So what I would suggest is if you've completed your family, then it is important to still see your period. Because if you are not on any contraceptive and you're not seeing your period because you're not ovulating, the cells inside your uterus can get up to all sorts of mischief and end up, because they're not regularly menstruating, they start to become cancerous. And so your risk of getting endometrial cancer is elevated. So management is generally to put you on the contraceptive pill long term so that you keep on menstruating.
yeah,
However, if you are very overweight and now going over 40, then your risk of getting a blood clot on the pill goes up. So then you may want to look at putting in a Mirena, where a Mirena will prevent you from having your period, but in a safe way, so that those cells don't get
yeah,
up to any mischief, and then that can assist with preventing any complications. Having a hysterectomy will stop your risk of endometrial cancer, but you'll still have those insulin side effects. You'll still have the
yeah.
weight gain issues. You will still have the androgen side effects in terms of facial hair, etc., because your hormones are coming from your brain and talking to your ovaries. They're still doing all those things. And I wouldn't recommend taking your ovaries out before menopause because there's evidence that that cuts your lifespan short, increases your risk of stroke, cardiac problems, dementia, all
Oh,
sorts of things, because it puts you into menopause early. So
oh,
the risk benefit ratio is not there. So being on contraception, definitely a must. But whichever one it is, I think seeing a gynae and personalizing that for you is a good idea.
okay. That is such a lot of information to take in, and there's quite a few women that is been watching this. So thank you so much for this talk, doctor. Yeah. So most important thing is that we all hearing is that those dealing with infertility, that is looking at starting a family, trying to start a family, and you've got PCOS, just losing 5 to 10% of body weight increases your chances of conceiving naturally. And
Definitely.
and another thing is also even just sticking to the Mediterranean diet, and you gave us the portion size as well. So that is actually such great information that you've given us.
I'm so glad. I really hope it's helpful. And if anyone wants more information, we're based in Umhlanga at VitaLab Fertility Clinic. And we also have a branch up in Sandton. So if you'd like to come and visit us, then you're welcome. I'll also put my email address here if anyone wants to contact me directly. I see there was a question regarding the Ozempic being out of stock. There is an alternative called Saxenda, Saxenda. It is a little bit more pricey, but it does the same thing as Ozempic. So that is an alternative.
Awesome. Yeah, if you guys have any questions, Dr de Jongh will put her email address in the comment section. Otherwise, they have got a Instagram page, they've got a Facebook page, and you can also go to their website, which is the vitalab.co.za or vitalab.com, am I correct? Where you guys can contact them.
.com.
Okay, there we go. Skye at vitalabkzn.com. So thank you very much for joining us again and giving this amazing information. And I'm sure there's so many women that are really going to enjoy but it's going to be useful to so many women. Thanks very much, Doctor.
Thanks for having me.
Have a great evening. Pleasure. See you. Keep well. Bye.
Bye.